It is open enrollment season. Families are making important choices about healthcare plans right now. In some cases, people are being forced to make changes to their insurance in order to do what's best for their families. And Tiffany, we know this is something that you're paying close attention to this morning.
You might remember back in October, we told you Southwest General Health Center in Middlesburg Heights has decided to end its contract with Humana Medicare Advantage Network. So that means patients with that plan would no longer be considered in-network at that hospital next year. With this development, I found that there are varying opinions about Medicare versus Medicare Advantage. People had a lot of questions. So whether you're close to or at the age to consider Medicare or have a parent or loved one who is considering their options, it's something for you to pay attention to. The breakfast options seem endless here at Big Al's Diner on Larchmere in Cleveland, but the choices on this menu are probably much simpler than figuring out which health plan to choose for you and your family.
My health's been a concern for a long time because I'm a 3-time colon cancer survivor.
I've been very healthy, but my husband passed away 2 years ago and he had a lot of health issues, and health insurance was a really important thing.
In your circle, like friends, people your age, is healthcare something you talk about often or?
Like all the time.
And as we age, healthcare options change.
Medicare beneficiaries are individuals that are 65 years and older, any age if they're disabled, typically for 2 years, or those with end-stage renal disease or Lou Gehrig's.
I spoke with Christina Regg of the Ohio Senior Health Insurance Information Program. She says the hotline offers free, objective, unbiased information to the Medicare population. Open enrollment, which is happening now, is by far their busiest time.
Please do not select your plan based on an advertisement. Because they're usually promoting added benefits, the enticements to enroll in those plans like gym memberships or debit cards. We really want folks to focus on the health and the medical benefits of their insurance.
There are two general options for those who qualify, Medicare or Medicare Advantage. So what's the difference? On a very simple level here, Reg says with Medicare, you can go to any doctor or provider in the U.S. that accepts Medicare, but there are more out-of-pocket costs. Medicare Advantage typically has lower monthly premiums, but in most cases, you have to go to a certain network of doctors and providers. 71-year-old Martha Fleischer is on Medicare, but considering a switch.
Thinking about Medicare Advantage for this year, it's on a strictly, what's the best financial decision to make.
But 84-year-old James Freeman has been on Medicare since 2005 and doesn't plan to change a thing.
Stick with your plan, okay? That's the best, your plan that you got, because it's all roped together, So that's what I did.
With so many options on the table, the best thing to do is ask the experts who are available to serve you with unbiased information to make sure you make the best decision. Well, some people on Medicare also have supplemental insurance from their former employer or union. While you're able to get Medicare at age 65, more people are working past that age, and therefore they are sticking with their employer-sponsored plans. To get that free, unbiased help from the state, you can call the number you see here on your screen, 1-800-686-1578. You can call that weekdays from 7 until 5. This information will also be available on our website under this story. And Mike, there were so many people on my social media when I posted about this talking about, Medicare versus Medicare Advantage. And so I made sure that I had that talk with my parents after this to see what they're doing. Also, my husband and I, we had that talk with our mother-in-law. It's confusing, but good thing that people can get the help that they need.
And I love when we do these types of stories. Not only are we helping everybody that is watching or reading, but in a way we are also helping ourselves and our family, right? We're learning something.